1 in 5 therapists has an unsettling habit that makes their patients worse, not better, a subtle behavior so insidious, most don't even notice they're doing it. It's called overly familiar mirroring. The goal of mirroring is to build rapport with the patient, but when taken too far, it can have disastrous consequences. Therapists who mirror their patients' mannerisms and speech patterns may seem empathetic at first, but they're actually sabotaging progress. This behavior is not only counterproductive, but it can also create a sense of unease in patients. So, what drives therapists to engage in overly familiar mirroring? One reason is the desire for a sense of control and dominance in the therapeutic relationship. Another reason is the therapist's own emotional unavailability or attachment issues. When therapists mirror their patients, they're often unconsciously trying to recreate a sense of connection and validation from their own past. But this behavior can lead to enmeshment, where the therapist becomes overly invested in the patient's life. Enmeshment can cause patients to feel trapped and lose their sense of autonomy. The consequences of overly familiar mirroring can be severe, including therapist burnout and patient abandonment. So, how can therapists avoid this toxic behavior? Firstly, they need to recognize their own emotional triggers and limitations. Secondly, they should establish clear boundaries and maintain professional distance. Thirdly, therapists should focus on active listening and empathy without resorting to mirroring. By doing so, they can create a safe and non-judgmental space for patients to explore their thoughts and emotions. In conclusion, overly familiar mirroring is a subtle yet insidious habit that can sabotage both therapists and patients.